Alrighty, I have the top of the hour and I want to be respectful of everybody's time. So, hello everyone, and thank you for joining us for today's webinar. We are here to talk about the Delta Region Community Health Systems Development Program, or we like to just call it Delta for short. This webinar today is being recorded. The link to the recording will be posted on our website and sent in an email following the completion of today's session. My name is Caleb Lozinski, the Outreach and Education Coordinator with the National Rural Health Resource Center. I'm joined today by Kate Stenyam, the Outreach and Education Manager with the Center, and Suzanne Snyder, the Project Coordinator from the Federal Office of Rural Health Policy. Just a few housekeeping pieces before we get started. Your audio is muted by default to avoid background noise and feedback. Please remain muted unless you have a question or comment. To unmute your line, please select the microphone icon in the lower left corner of your screen. If you dialed in, press *6 to unmute your line. You can also communicate through the chat box, which is located on the bottom ribbon in the middle of your screen. If you haven't already, please take a moment to type your name, your title, and your organization into the chat box so we know who is joining us today. Our agenda for today is to provide an introduction to the Delta program so that you can familiarize yourself with the goals of the program, as well as the application cycle and eligibility requirements. The National Rural Health Resource Center is a nonprofit organization dedicated to sustaining and improving healthcare in rural communities. The center is the TA provider for the Delta Region Community Health Systems Development Program. The center is committed to diversity, equity, inclusion, and anti-racism, and building a culture where difference is valued. You may learn more about our commitment on our website. The Delta program is funded by the Federal Office of Rural Health Policy in collaboration with the Delta Regional Authority. It is my pleasure to introduce Suzanne Snyder. Suzanne serves as a public health analyst at the Federal Office of Rural Health Policy and the DRCHSD Program Coordinator. Suzanne, thank you so much for being here today.
Thank you so much, Caleb, for being here today. Thank you for that lovely introduction. Hello, everybody. I want to personally welcome you to the webinar to learn more about our program. And I just really want to thank you for your interest and just the time that you're taking in joining us today. It is a really unique opportunity, and what I tell folks is that it is one of the only federally funded programs that are quite like this, just with the amount of resources and the intensive technical assistance that you can receive as a participant. So I'm really excited to be able to share more about it. Before we kind of get into the details of the program, I wanted to talk a little bit about eligibility. So when it comes to eligibility, eligible applicants for the Delta program include small rural hospitals. So you can see on this slide here, that's including critical access hospitals, PPS hospitals, and rural emergency hospitals as well. This also includes rural health clinics, small standalone or independent clinics, federally qualified health centers, and other healthcare organizations that are located in the 252 designated counties and parishes within the Mississippi Delta region. So this slide gives you a view of who we've served thus far in the program. It includes graduates and those that are currently participating in the program. The Delta Region Community Health Systems Development Program is now in its 7th year. And so in those 7 years, the program has served 63 healthcare organizations across 61 different Delta communities across the 8 Delta states to sustain and expand access to local healthcare services. If you are not totally sure if your organization is eligible, or if you are a state organization, a state partner that's on the call today, and you've got some interested clinics, and you're not totally sure if they're eligible, then I would really encourage you to reach out to the folks at the center. They'll be able to help clarify that status with you. And if we go into the next slide, I will transition over to talking a little bit more about application process. So if you feel you're ready to take that next step after you hear everything that this program has to offer and you'd like to apply to become a participant in the program, you can submit an application using the center's online application on their website. Applications are accepted on an open and rolling basis, so you are more than welcome to submit an application at any time throughout the year, and your application will remain on file. eligible organizations are considered for future openings as well. After your application is submitted, the center schedules a review call of your application to get to know you a bit better, get to know your organization, answer any questions you might have about the program or those technical assistance resources, and really just take the time to hear where you're at right now, the strengths that you've got, any barriers that you're facing, and also just confirm that you're in a position to be able to commit to the program and see how this program can be a good fit for you. So I would just really, really encourage you, if you are interested at all, do apply sooner rather than later so that you can be considered for our next cohort that's beginning program activities this winter. As you see on the slide here, we're accepting applications until August 1st for our next cohort. More than welcome to take your time to consider this opportunity, really think it through, talk to your team, apply after August 1st if you so wish. But if you feel really ready to be a part of this program sooner rather than later, then be sure to get your application in before August 1st of this year. Now, going on to the next slide, I'd like to kind of set the stage for Kate, who's going to talk a little bit more in depth on what this program looks like. But what is this program? So the Delta Region Community Health Systems Development Program, you'll also hear it referenced, I think I've already done it thus far on this webinar, as the Delta Program or the DRCHSD Program. This program improves healthcare delivery in the Mississippi Delta region through intensive multi-year technical assistance to healthcare organizations that are located within the Delta region. The program seeks to help communities develop a local sustainable system of care and really seeks to assist leaders and providers with making in-depth system enhancements to secure access to local quality of care and also to support value-based care and moving towards population health. So if we go on to the next slide, you're going to be able to view the Delta program's goal areas. So this program helps rural healthcare organizations continue to deliver care to their communities by working closely with leadership in implementing best practices, in building partnerships, and in collaborating for sustainability ultimately. You will receive intensive and very forward-thinking technical assistance that looks to improve financial and operational performance, build connections and develop a community care coordination plan, and ultimately strengthen your healthcare delivery to continue to sustain access to care for your patients and your communities. With that, I'm going to pass it on over to Kate to describe more in depth what all is covered under the technical assistance services for this program. So Kate, take it away.
Sure. Thanks, Suzanne, and welcome everyone. I'm so glad you're able to join us today. I'm just going to get into a little bit more of the details of the program. And so what you see on your screen right now, this is really looking at the roadmap for success for clinics who are approved to be part of the program. So I just wanted to say, I know some of you were on the hospital and FQHC webinar that we did just a little bit earlier this afternoon. If you missed that one and you want more information specifically about what it looks like for hospitals and FQHCs who are in the program, Caleb can send you that recording as well. And that was just another like 30-minute overview and presentation. But talking about the clinics today is a little bit different the way that it's set up for the clinics to make sure that the clinics are very successful. We know that the clinics, of course, and the independent clinics don't have the staff numbers, obviously, that a hospital or an FQHC has. And so we take it definitely more one project at a time. And so if the current funding levels continue the way it works with the clinics that are in the program right now, they're with us for approximately 4 years in the program, where hospitals and FQHCs are more looking at a 3-year time frame. So it's done in different phases. So the clinics in phase 1 through 3, as you can see there, really focus on clinic readiness and financial assessment. And then again, that's a very, very step-by-step approach, doing those assessments and looking at the best practice recommendations and their unique priorities of what they're going to focus on to implement in each unique area. Then the next one is moving into systems and IT readiness, and that's really digging into to prepare for telehealth preparation. And then also after phases 1 through 3 are completed, that's when the clinics start onboarding their community champion and digging into the community care coordination component of the program. The bottom bullet there, the workforce and leadership development, that can be encompassing and happening all the time. So if a clinic is starting the program, they can jump right in with doing an employee engagement assessment at the very beginning of the program and then work on different workforce and leadership development strategies throughout the entirety of the program. Next slide, Caleb. So, as I noted before, following the completion of phase 3, that's when an IT readiness assessment is initiated as the next step. So that assessment really looks at the IT infrastructure and deficiencies, and that really to support telehealth implementation. For example, this can include network, broadband services and connectivity, monitoring capabilities, optimization, policies and procedures. And the identified IT readiness deficiencies, those need to be resolved before initiating a full telehealth assessment and benefiting from those components of the program. So one really great success, there's been lots of successes, but one that we have a really nice spotlight video on here is with Urgent and Primary Care of Clarksdale, and that's a clinic in Clarksdale, Mississippi. They are part of Cohort 2020, and they receive telehealth equipment and technical support, including a system selection, workflow, policies, and procedures to really help them launch a new telehealth service line. And so not only does Dr. Williams, who's the owner of this clinic, give a nice overview of what they did for some of their telehealth initiatives, but this gives a whole picture into like different areas that they worked on with the entirety of the program. So we're gonna have Caleb pull up that video and play that for all of you. And this is just like a 4 to 5 minute little spotlight video.
One second here, it is on the slide deck.
And I should mention too, if anyone has a question at any time, you can feel free to just come on mute and ask it, or of course, pop it into the chat box as well. We'll also take any questions that you might have at the end of the presentation too.
And gave me a whole new outlook on life. It's a win-win for the community. I'm just honored to have been chosen for this opportunity. It is a phenomenal resource.
The Clarksdale community is a very close-knit community. We have a lot of strengths. We also have a lot of challenges, particularly when it comes to living a healthy lifestyle.
The patients helped me to become aware of what it is they would like to see, what it is that they need. The access to healthy food, that was like one of our top priorities. A lot of them either don't have transportation to get to Walmart, which is our like only major grocery here, or they don't have the monies to buy those foods. It popped into my head with my group, okay, well, let's look at starting a community garden.
I think it gives like people in the neighborhood an opportunity to not only get access to fresh vegetables, but it also gives them some ownership because they get to partner in making sure that their garden is well kept. And it just brings people together in the community.
Our town is no more than 5 or 10 miles, wide, but lack of resource, access to healthcare, and things like that are things we're working on, which is why telehealth is so important. If they can't get here, then they still can get their, healthcare done. We do offer a telehealth service. If you have a phone or computer, they find that it's very convenient. And the fact that they still get to see the doctor, and they're impressed that we're the only ones doing it. The Delta program did a phenomenal job with telehealth. I mean, from A to Z.
UPC was ahead of the curve, or in touch with technology, where they're accommodating the people in the community.
Community is everyone around you, no matter how. We all play a part in community. That's the incarcerated, that's the law enforcement officers, that's the other healthcare providers, that's the people in the community, that's the local workers at Walmart, that's our community. So if we want a healthy community, if we're growing a healthy community, that includes everyone, including the ones that are incarcerated.
They got a medical exam room with the telehealth machine set up, where they're in a private medical room where they be able to see what's going on and communicate back with the primary care. You don't have to have a deputy to transport them to a facility. You could treat that person right where they are.
If we can keep them healthy or teach them about health, they have a higher rate of integrating back into the community. So the goal is to create an environment where we don't have a break in the continuity of care.
Being incarcerated is supposed to help rehabilitate a person, then making sure that their health care and their mental health care are priorities is really important in that rehabilitation process.
The Delta program has helped me interact and treat my community in multiple ways.
It has been a learning, and it is continuing to be a learning experience. The program has taught me that, how to have focused conversations, how to bring people together, how to intentionally, or shall I say strategically, put a group of people together to reach a common goal.
We have built so many different or new relationships, or encouraged or made stronger relationships that we already have. With Delta in the picture, this community has seen a lot more of urgent and primary care.
When I tell them that I work for UPC, they'll say, "Oh, UPC. Oh, that's Dr. Williams' clinic out there." They see us out in the garden when I bring my truck and put the banner on it. They see us at the community events, so they know us.
We have created something I know people will talk about for years and years to come. We built a legacy, writing our story, urgent primary care in Delta.
Great. Thank you so much, Caleb, for playing that for us. And I think that gives a really good picture too of showing that this program is really unique and can be tailored to meet the very unique needs of each organization that participates in the program. As the organizations go through their different assessments, they work on the best practice recommendations and highlighting their key priorities for their organization. And you could see in that video that a couple of the key priorities for urgent primary care of Clarksdale were providing primary care services to their local detention center. That was an area that was a need for the detention center, the part of one of their community joint partners, but it was also an area that UPC could really grow their services and grow their market to meet the needs of the community. And another area through the community care coordination component of the program was looking at addressing some food desert issues, and by bringing a bunch of community joint partners together to build a huge community garden. Another way for them to meet their community needs, help their community be healthier, build more sense of community collaboration together. So I think that video just does a really nice job of showing how this is very unique, and all of our sites have had very different unique needs throughout the program that we've been able to help them with. So the slide that's up here is just as hard stops to support implementation and sustainability. And so that is like just outlining that there's review calls that are held following each phase. And we want to make sure like the clinic's success is our success, is the federal office's success, right? We just want to ensure that the sites that are in this program are very, very successful. And so that maybe we didn't get this fully implemented, let's stop and pause, make sure this is really complete, and then we're going to move on to the next phase. We know that all of our healthcare organizations are extraordinarily busy, and we don't want to overwhelm them. So if we're taking it step by step and making sure that we really truly find success in each area, and then we move on to the next component of the program. You can go on to the next slide, Caleb. So this, as you saw in that video, Ksenia Lampkin is the community champion for urgent and primary care of Clarksdale. And so what the community care coordination component of the program really focuses on is community engagement in the planning. And those are so essential for the organization's viability and their financial viability as well, because it really focuses on building broader awareness and utilization of the services that are there locally, which of course then in turn helps to improve and increase patient loyalty and grow market share. This program is not about cutting services. This program is helping you find out where there's gaps in care, gaps in services, so that you can grow your market share and better meet the needs of your community. And we do heavy evaluation, and the program evaluation results really show that all of this CCC planning positively impacts the healthcare organization's reputation within the community through improved visibility and marketing. Next slide, Caleb. So this slide right here, this goes over the community champion. And like I said, in that video, Ksenia Lampkin is the community champion for the clinic in Clarksdale. And the community champion is a very critical component of the Delta program and the Delta program's approach to community care coordination. So participating organizations receive direct funding for the salary to support a community champion who is hired by the healthcare organization and is located there. It is really the boots on the ground locally for the community care component of the program. And this position is supported at salary at a 0.6 FTE throughout the program. So that champion really acts as a liaison to support the healthcare organization's community engagement goals and to facilitate the development of a sustainable community care coordination plan, working with their leadership at the healthcare organization, as well as the community joint partners within their community. And I should note there too that our center staff here on the community care team, they provide all of the professional development and the one-on-one coaching to build and strengthen that champion and make sure that they are ready, they have the capacity to be successful in that position. Next slide, Caleb. So workforce and leadership development, we all know that employee engagement is really correlated with patient satisfaction and also quality of care. And so leadership and staff development are so essential to the organization's overall success. So the Delta program supports a wide range of services to help leaders address workforce needs. And you can see just a couple examples that are listed on that slide. These services are really customized for the healthcare organization. And this is an area of the program that can be from the beginning to the end. You could start off with an employee engagement assessment, see what priority areas you want to focus on. Let's say it's even mid-level management, and then be working on those trainings in the next couple of years and redo your employee engagement assessments to see if you've had an increase in satisfaction. Next slide. And then our annual summit, we do a lot of education through that program, and this can be on site. This can be lots of virtual webinars, lots of boot camps, different types of boot camps. And then we also host an annual summit. This is an amazing time for all of the participating organizations to come together, to network, to share, to get more education. That's 2 days, of course, in person. This year it's in New Orleans in September. The program has the funding to support 4 participants from each healthcare organization to attend, so it pays all the travel expenses. The CEO of the organization, as well as the community champion, are required to attend. That's part of the agreement of coming into the program. And then the participation expectations, because of the significant amount of time and funding that is made available to each participating organization. The executive leadership, of course, is expected to be fully participating in all facets of the program. It's not a la carte. They have to participate in all components of the program. And they will be required to sign a memorandum of understanding as well when they join the program. Most of our independent clinics don't have a board, but some do. And so if they do, the board chair is also expected to sign the memorandum of understanding before they can start any activities in the program. Next slide, Caleb. And this is just a slide that shows some of the results that were aggregated from our most recent graduated group that graduated this last fall. And then if we could open it up to questions. If you have any questions for myself or for Suzanne, I know we have some other colleagues that are on the line as well. Come off mute, pop them into the chat. We're happy to answer any questions you might have. I'll just put another plug in. Suzanne had mentioned before, we take applications on a rolling basis. But if you really want to participate in this upcoming cohort, you need to apply by August 1st. And then we'll be finishing up all the application interview calls by the end of August. And how it happens, then we take all that information, make our recommendations, but the Federal Office of Rural Health Policy and the Delta Regional Authority have the final say or the final approval on who gets to participate in the next cohort. I will say we've already been receiving a lot of applications, and Caleb and I have been busy doing interviews. We even had one earlier today. So I would really encourage you, if you're interested, to apply and at least set up an exploratory call so we can learn more about you. Yep, thanks, Caleb. If you want to go to a couple more slides down too, we have our contact information on there. And please feel free always. I'll speak for Suzanne. You can always reach out to Suzanne as well if you have any questions for her. Okay, well, not seeing any questions coming through. I just want to thank everyone for their time today. We really appreciate you being on. If you have a question that comes to your mind, even within like 5 minutes after this, or maybe it's 2 weeks later or 3 weeks later, please feel free to reach out. We're all available and we welcome any questions that you might have. So with that, I guess we'll give you a few minutes back into your afternoon.